Cardiologist Mimi Guarneri of Scripps Integrative Medicine explains how it works.
It's based on the concept that this is our physical body, but extending out from our physical body is what's called our energy body, and that the energy body can be manipulated through techniques.
It's a very light touch, and then we do things like balancing our chakras, opening them for the patient, clearing their electromagnetic field.
It's not a massage. Sometimes hands just hover above the body.
No, it really doesn't feel like anything.
Still, according to a decade of research, this kind of touch therapy cuts pain and recovery time in half.
There's been a number of research studies that have shown that healing touch can promote reduction in pain, relieve anxiety, accelerate wound healing.
Physicians are slowly going to be changing, but it's going to be changing because the public wants it. The public wants hands-on. The public wants compassion. The public wants somebody that's going to listen to them and work with them. And they're going to start demanding it more and more.
What if we told you that the power of human touch can ease painful migraines and that it can actually help the body heal from an operation or from an injury? It is a non-traditional medicine, and as Fox 13 Cynthia Smoot tells us now, it is in high demand at a Bay Area hospital.
Kimberly Garcia is a registered nurse, has been for 23 years, but it's her other training as a certified healing touch practitioner that brings her to this bedside.
And so we're just allowing the energy to move back and forth between our hands.
Healing touch uses the energy we all have, what's called our biofield, to help the body help itself. Garcia says doctors at St. Joseph's Hospital were a little skeptical at first, but after getting relief for their own aches and pains, have come to appreciate what she has to offer.
I do have doctors that write orders on the patient's charts for healing touch sessions. One physician had mentioned actually making it a routine post-op order, and I was like, whoa, wait until we have enough people to do that.
One hospital embraces healing touch, and their satisfaction goes, the patient's satisfaction goes up. And then the other hospital says, well, how can we get one of those programs? Well, how can we get one of those nurses? And that's the way it's going to go, because the public is going to seek the practice where it is being offered.
Some Twin Cities hospitals are offering cancer patients more than chemo for their fight. A healing touch and a little incense, that might become part of the prescription.
Healing touch has also saved patients money by reducing hospital stays as well as the need for medication. It even has an insurance billing code now.
To me, that's what's really exciting, is we're changing the world one step at a time, or one person at a time.
Janet started researching energy-based therapies and energy medicine 20 or so years ago. She was an RN, and she felt that we were losing compassion in healthcare. So she developed a Healing Touch program to allow people in nursing to relate with their patients and come to a point of understanding that their energies could come together and they could help each other in the healing process.
The program was put together by Janet step by step, energetically, and it speaks for itself.
I believe Janet's vision for people was to be able to offer well-being, that in a way that was empowering for the person, simple. All you need is a pair of hands and a centered heart, and know the techniques. That is, the simplicity of it is the beauty of it.
It was really a gift to continue to take classes with Janet and watch as she was called to bring this out to the country through the Holistic Nurses Association. And watching that unfold as her curriculum, her program in Denver became a national program, and then eventually an international program.
Healing Touch is now taught in the 50 states in the U.S. and also in 30+ countries around the world. We have the Healing Touch International Foundation, which is our foundation body that gives grants for research and other healing projects. We also have Energy Magazine, which lists the classes in the magazine and also gives you stories about how Healing Touch can enhance your life and those around you.
It wasn't long before it started traveling to other countries, so that now we have active organizations in a number of other countries and classes all over the world.
As we visited Lima, we were taken to an area where they have a Healing Touch center set up. It's set up on a dump. These are people who squatted, came from the hills. It reeks of methane gas. Vegetation doesn't grow there. Yet you have this wonderful spiritual center of Healing Touch. These people don't have medical care. The only thing they have is a Healing Touch program there that allows them to use their spirituality to help each other, ease each other's pains.
Healing Touch has given them an opportunity to work especially with the domestic violence that's prevalent there. Whenever you have poverty, you have an awful lot of domestic violence. Working with women who have been raped since they were children. This program has empowered them because they can now do something for this situation.
You never know where Healing Touch is going to lead you. The next thing you know, you may be in Ecuador teaching classes in slum barrios and traveling all over that country, bringing the word of Healing Touch to people who have very little medical service and very little way to make any difference in their lives. You know, they're living very on the edge. That was part of my opportunity, and it never ceases to amaze me, you know. I'm open, I'm willing, and I never know what that next thing is going to be.
Our current vision is exactly the same as Janet's always was, and that is to see Healing Touch practiced in every home, every hospital, every healthcare facility, and every school.
Giving people the opportunity to change their lives, to be well, to have input into their healing, and to have hope. So Healing Touch equals hope, and I think that's the most important thing that you can do.
Healing Touch was what I'd always been looking for since I went into nursing, which I'm not even going to tell you how many years ago that was.
I believe in Healing Touch, and I've seen my patients benefit.
There's a quote that my mentor says all the time, and she says, and I'm sorry I get a little emotional, but she says, I'm the best person I will ever be when I do Healing Touch. That's exactly how I feel.
So empower yourself by learning more about Healing Touch. You can visit our website to find out more about our program, learn about how people are actually using Healing Touch in their communities, find a practitioner, find classes in your area, and learn the gift of touch.